Okay, great. So this is about gut health, but it's really about the whole body and about the brain. And we have these talks once a month, sometimes more frequently. Um, Check in with Caitlin, who we're so lucky to have organizing these. Um, Functional medicine is different from other types of medicine, whether that's naturopathic, whether that's chiropractic, whether that's traditional medicine, because it requires you learning. It's about you understanding your own individual body so you can make choices on an everyday basis that helps to promote vitality in your body. And getting the gut to work right, because it's not on and off, it's a rheostat. Your gut, because it's interfacing with the environment every day, the food that you eat. And do you know we eat like 5 tons of food in our lifetime? When somebody said that, I was like, oh my God, that's a lot. And that's a lot of filtering through junk that's in our food, whether that's stuff that's been processed or whether that's just what happens in the natural process from the ground to our tummy. There's a lot that's in there, right? And it's designed, our gut is designed to handle that. But oftentimes, either because of stress or because of infection or because of misunderstanding about what works for you, the gut is off. So I was just thinking, we have all these bottles up here. These are meant to be my tickler to remember to talk about things. But I had them up front. Caitlin wanted me to bring them back here. She knows me too well. Um, but the last patient today. She had this pile of supplements, and I like to emphasize to people, my goal is not to sell supplements. We do sell supplements, and we sell supplements because you can't get these in your local grocery store. But ideally, we should be eating in a way, once we figure it out, once we get everything tuned up, where our food is really our medicine. I'm not going to say that I've got there, but I mean, I still take pills. I still take supplements. But the goal here is not to sell you a bunch of supplements. The goal is to begin to stimulate some information and some understanding of what your next step is in being able to interface with your food and be happier, healthier, and more relaxed, sleep better, and just generally feel like you're able to digest your food well. So William Shakespeare said, our bodies are our gardens, which our wills are our gardeners. And I love that. I love that because it reminds us that we have to make choices and we have to direct the course of how we treat our body. And that it should not be unconscious, it should be very conscious on a daily basis. So hopefully I'll give you some information that will help you tweak that. And I started to say, our guts are on a rheostat. Some people think, okay, I checked for leaky gut, I'm done. No leaky gut, I'm done. But because it's always interfacing with something new and different, our guts are constantly fluctuating and moving back and forth. And that's one of the reasons that it's a good idea to learn how to read your gut and read what needs to happen next. I love that on the TV and other places, they're advertising probiotics. I love it because it's become mainstream to understand that bacteria can be our friends. And there is, at the end of the PowerPoint, there's a reference to a book called The Gut Balance Book that was written by Gerald Mullen, who is a gastroenterologist at Johns Hopkins. And I've heard him speak many times. He wrote this book. I bought it, read it, bought 20 more, and give it to people regularly. He's really a character. He started out as an obese teenager and became a gastroenterologist because he had gut problems. And he began to tweak things, learn things. And in essence, what he does, and I didn't expect this, is he tells his story and then talks very specifically about the kinds of foods you want to eat to optimize your gut microbiome. And he has the research behind all of it. And it's actually stuff that he does and works for him. It doesn't mean that it's exactly what's right for you. Everybody is unique and different. But he went from 300 pounds to 160 over the course of a decade when he was doing this research. So tweaking your gut can do a lot of different things. It can help you lose weight. It can help you feel more comfortable in your digestion. And then one of the things he found out, just serendipitously, is that it actually helps with mood. And as I said, serotonin and dopamine are made in the gut. And if you don't have enough serotonin and dopamine, life is not fun. You don't feel satisfied. You don't sleep well. You don't think well. You're not interested in new and different things. The fact that you're here, you probably have enough dopamine right now. But keeping and tending to your gut will help to maintain brain health and mood health for the rest of your life. So in one of the pictures you have, and I think you have the full-on picture in your folder, is this one, which is like a triangle. Do you guys see it? Yeah. Okay. I think everybody has it. Yeah, that one.
Your PowerPoint is on the left side of your folder.
I don't
Dr.
have
Alexis
one.
is a little.
You don't have a
Let me
folder?
grab
I don't have a folder.
I pulled it out for you in there too.
Thank you.
We'll do the creepy stuff first. So at the bottom is the gut. And then it shows references or shows arrows where there are neurotransmitters going from the gut up to the brain. And then there's information from the brain going down to the gut. And that is, you don't have to study this too hard because I'm gonna break the mystery here. Essentially, we have to have an active parasympathetic nervous system for our digestive tract to work. In order to have an active parasympathetic nervous system, you have to have serotonin in your system.
Yeah.
There's the vagus nerve. There are lots of books out now about the vagus nerve, post-traumatic stress syndrome, how the vagus nerve can cause problems after some traumatic event. And they talk a lot about things like anxiety, fainting, dysregulation of the sugar, all kinds of really stressful things for people to deal with. But on a very small level, oftentimes what a vagus nerve disruption will cause is constipation or irritable bowel. And some people don't even realize that that's coming from their brain. The vagus nerve is the longest nerve in the body, and it starts up here, comes out between the skull and the first vertebra, runs down. And I think I put a nerve chart. You don't need to get it out. You can look at it tonight when you're fascinated with this and you're reading it. Is that it supplies all the digestive organs and the heart and the lungs as it descends down through the thoracic cavity. So I treat, and it's surprising to me how many people have problems with the vagus nerve, but if you've seen me already, you know I ask you to stick out your tongue and say ah. And the ah is, I want to see that punching bag in the back of your throat pop up. And if it doesn't pop up, then we know that the vagus nerve isn't as robust as it should be. So we get on a program to make that as robust as possible. And you have directions for that. If you have a spouse or children who will look, it's hard to see yourself. You gotta have somebody else look. But all you have to do is say ah and see if the punching bag in the back of your throat pops up. Don't open up a practice within 10 miles of me. You guys can open up but you could make your life work helping people get their vagus nerve working, and you would do a lot of good. So one of the first things we do is assess whether the vagus nerve is working correctly. The second thing we do is see if you have a leaky gut. So everybody now, I think, has heard the word cytokines, right? No? Oh, so I'm sorry, Mary, what? Cytokine. Am I talking, should I get up and project better? Okay, all right. Yeah. Cytokines, you know, the whole COVID thing, the concern is the cytokine storm, and that's what kills people, that's what leaves them disabled. Cytokines are the immune cells that come in to help clean up the debris, and cytokines are also just debris that's not supposed to be there. So cytokines, which are represented right in the middle, will cause and disrupt the flow between the brain and the gut. And so when people are super toxic, or if they're sick, they have a virus or a bacterial infection, oftentimes this will be disrupted. So again, just check every once in a while. Is my punching bag popping? Right? And then if it's not, the big fix is to gargle or sing for 30 seconds twice a day for 2 weeks. We usually give people a robust amount of DHA, which is a essential fatty acid that the brain and nerves just love, and we get it going. We've had a few people we've had to do more than that, but that usually will get things going. So once we're sure that the vagus nerve is working, and I should add that sometimes we just plain old need to adjust them because either their head's out or their neck's out and the nerve just isn't working the way that it should be working. Sometimes we have to do acupuncture, and acupuncture's big claim to fame, one of its big claims to fame, is GI problems. And the reason that acupuncture works for GI problems is because it turns on the parasympathetic nervous system, and that's what the vagus nerve is. And if I'm talking about this stuff and it doesn't make any sense or you don't know what it is, don't worry. Jot down a note and we'll talk about it afterwards. The parasympathetic nervous system is the part of the nervous system that rests and recover. So for people who aren't sleeping or for people who are very anxious and revved up, oftentimes we have to get them sleeping to get their vagus nerve working and to get their digestive tract going. And then some people just never have really known what it feels like to relax. Like he knows how to relax, right? And somewhere along the line something happens and it jars our system and we think the new normal is that we have to be like this. But I would also encourage you, be out in nature. That stimulates the parasympathetic nervous system. Chewing, oddly, stimulates the parasympathetic nervous system. So when you're eating, make sure you're really chewing your food. And then the other thing that's simple and easy to do is a conscious, mindful breath. And you have in your folder some things from the Institute of Functional Medicine that instruct you on gentle, deep breathing that will stimulate the parasympathetic nervous system. This is a side note. Have you guys ever heard of Wim Hof? He's a Dutch guy who is known for swimming under icebergs, being under in cold, just like ruthlessly cold water. Anyway, he now is he and his followers are the subject of studies in Rotterdam, and they're fascinating studies about autoimmune diseases because they find that if they breathe and then dump themselves in cold water and try to avoid having regular temperatures at all times, in other words, stressing the body a little bit with cold and hot, and we certainly do stress our bodies with the heat that we have here in the summertime, that the immune system will balance out. So, I'm going to get to the side note. Exhaling. Most people don't realize how exhaling and fully exhaling, really emptying your lungs out, can help to turn on the gut. The people who do know that are singers. Singers have prolonged exhalations. They know what it is to have a prolonged, very sustained exhalation. So if nothing else, when you're practicing breathing, because I know you will, practice just exhaling. You can do that while you're driving. You can just exhale, hold it, and exhale a little bit more. One of the treatments for somebody who is anxious or constipated, odd that those two would be linked together, is to have them learn to exhale and then hold the exhale for 30 seconds and gradually increase it to about 4 minutes. And I know, 4 minutes really. I had a woman come in the other day, new patient. She said, well, I've been practicing the Wim Hof and I can do 4 minutes. And I thought, you liar, you're not doing that.
No.
But I do know you can get to a minute and a half. I think she's cheating and she doesn't realize, but next time I see her, I'm gonna make her do it in front of me.
Maybe she's breathing in and out slowly for 4 minutes.
No, she said she fully exhaled and would hold it for 4, and I just was like, okay, I'm gonna pretend I believe you, but 4 minutes is a long time.
Count of 4, because that's one of the trainings
Maybe
No.
that's what she's thinking.
No, it's not. And I'll tell you why. Because Wim Hof.
We're trying to find something.
Yeah, you're trying to be nice.
Yeah,
Wim Hof really encourages you to first do 20 seconds, then try to work up to 40 seconds, then work up to a minute, then work up to a minute and a half, and then from there you go to where you want to go. And one of the reasons he's training people to do this is so they can dunk their head under icy water for. And if you saw the movie with Charlize Theron, Blonde. Oh shoot. Blonde was in the title, but she was in Germany and she was a secret agent or something. And she did a full-on ice bath in front of everybody through a clear tub. And I know she'd been practicing her Wim Hof, and she stayed under there for a good minute and a half. And it was a beautiful scene and also powerful, because people who learn how to do that actually can regulate their autonomic nervous system. And what is regulated by the autonomic nervous system? Digestion and immunity. The heart as well. Now, I'm not going to ask you to do that, don't worry. But I just want you to know that exhaling is the most powerful part of the breath. And learning to take a full, deep exhale and then pause a moment before you take in will really help your digestive tract become more stimulated by the nervous system, because you're turning on the parasympathetic nervous system. It's also a great thing to do if you're not sleeping well, because sleep is mediated by the parasympathetic nervous system. Way more information than you wanted. So, one of the best ways to have a good, robust digestive tract is to eat a diversity of food. And I am probably the most guilty of this. So I'm not saying that anything other than all of us tend to go in this direction. We find foods we like, and then we eat them over and over and over again. My Amazon account testifies to that. But the more diversity we have, the better off our gut is. It's interesting to note that foods that are alive, like in the fruit and vegetable department of any grocery store you go into, if you look at the greens, they should have a little white strip on the veins, the main vein. If you get your vegetables and fruits from a farmer, or you have a CSA or something like that, you should see some white on the vegetables. That means they're fresh. But you know what that white is? It's bacteria. It's what you need to grow a good microbiome. So obviously the best thing is to have your own garden, but if you can't have your own garden, then having a CSA or being able to go to a farmer's market is the second best thing. And while you're there, make sure you get foods that you don't necessarily use very often. Try to keep circulating and using new and different foods. Of course, as you get older, that's harder to do. But sometimes learning how to cook from a different culture is a good idea. I had a time in my early life where I was lucky enough to live with somebody who cooked like a Japanese peasant. I mean, we had daikon radish, we had burdock. Now I only take those things in pills. But if you know how to cook them correctly, you can get the good bacteria from them as well. So diversity of foods, diversity of cultural foods as well. Korean foods like kimchi, and there's another one that I forget right now, are really rich in bacteria, and it's generally a different bacteria than yogurt would have. So we're not just looking for the bacteria, but we're also looking for the fiber.
I learned eat the colors of the rainbow, and that really helped.
Get
to
some
think
more
of what
diversity.
you just had, and then choose something in another color family.
That's a good way to do it. The thing about the colors is that they actually have their own phytonutrients that are actually antioxidants. So eating the rainbow is a really good way of doing that. I'm going to recommend something that to me at first I thought, yeah, no, not only am I not going to do it, but I'm not going to tell people to do it. But I have to work into things slowly. The slurry, and I think do they have a recipe for the slurry? Okay. Okay.
in the PowerPoint. And I'll send the PowerPoint to you in an email afterwards so you can have the full expanded lead color version.
Great.
Thank you.
I'm so lucky to have Caitlin and Ginny, who are both educators, to help me figure out how to communicate to people.
You're
I'm serious.
already great at it.
Well, I don't know about that, but you guys definitely back that up. So, different fibers in different foods help you to make short chain fatty acids in your gut, and we'll talk about what that is. But they also produce different fibers. And you want short chain fatty acids to build barriers in your body. We have just about everybody's heard of leaky gut. Leaky gut is that you don't have the barrier between your blood and your gut, or the poop in your gut. Leaky brain, less popular, less talked about, but we do have leaky brain. Anybody who's had head trauma, anybody who's had any kind of poisoning, generally will have a leaky brain. Which these are discrete barriers that are generally in the vessels, but we also have this barrier called the pericardium that wraps around the heart and the lungs, and this is like the gut barrier, the blood-brain barrier. And we have one in the kidneys, we have one in the bladder, we have them in the skin, we literally have them around every cell. And not to perseverate on COVID, but people who are falling victim to COVID and long-term issues around COVID are not just that they have pre-existing conditions, but they have leaky barriers. Their body isn't able to contain it, and the cytokines move into areas that should be kept discrete from other areas. And I think that's going to be a big health issue, not now, but in years to come. The people who, just like people who have had mono, will often have an Epstein-Barr viral load that stays with them for years and causes health problems, or who have been bit by a tick, can have long-term problems. So keeping your barriers discrete, built up and strong is the number one way to prevent yourself from having long-term problems in any scenario. And the fibers, the different kinds of fibers from different kinds of foods, help you do that. Now, Caitlin brought the bottles out to remind me. We actually give people butyrate for that. And butyrate is made in our gut by fibers interacting with lactobacillus. I have had the pleasure of working with people and doing this for a long time, 30 years. In the last 6 months, I've had 3 people who we couldn't get the barriers up, and I've never had that problem before. I'm like, what's going on? They had vagal tone issues, they have post-traumatic stress, and they can't seem to turn their parasympathetic nervous system on. One of them had had brain surgery when she was a child, and I think she just has had a long-term, her body's homeostasis is set at leaky gut, leaky brain. But this is a prebiotic, and if you guys have done any reading, you may have read that people like me, functional medicine docs, are recommending more prebiotics than probiotics. Do you know, have you all read that or no? Okay. Well, we are recommending more prebiotics than probiotics because people are developing SIBO from taking probiotics. SIBO is small intestine bacterial overgrowth, which feels like 20 to 30 minutes after you eat, you start to bloat. Or you always walk around kind of bloated. I have my youngest patient that we've treated for that is 5, I think. And that little girl, she was so cute. But she did have quite a belly on her. And she kind of looked like she was chubby. So you kind of thought, well, But I saw her about 6 weeks after we got her going on getting rid of the SIBO. And her tummy was perfectly flat. I mean, it was really, it was kind of exciting to see that in a little kid. Most of us know that we have SIBO because we feel miserable after we eat. And I see multiple people every day who have this problem. The way to fix it is to stop taking probiotics, find out what's in your gut that's not supposed to be there. But the big way to kill it is to stop eating carbs. And so I usually have people stop eating carbs, eat a FODMAP-free diet for 2 weeks, And 9 times out of 10, that'll take care of it. As a matter of fact, one of the things I'll recommend is doing a stool analysis. And to do a really beautiful stool analysis, I've only a couple times gotten people on board with this. If you stop your probiotics, stop digestive enzymes, stop yogurt, stop all the stuff that might be seeding your gut, eat 30 grams of carbs only a day for 2 weeks, and then do a stool analysis, you can get a really amazing read on where the imbalance is. Now, like I said, it's hard to get people to do that. But I have had people do it, and some of them have lived on the Eastern Shore, and they feel so much better after the 2 weeks of low carbs that they don't even want to do the stool analysis. But I usually like noogie them, like, oh, do it, and they finally do it. And what we learn from the stool analysis is life-changing. If you have SIBO, small intestine, bacterial overgrowth, usually there's a history of antibiotic use. And that's where a lot of people know about probiotics, that if you use antibiotics, then you probably need to take some probiotics, right? And I have to say, I have to get on board with that. I would agree. As a matter of fact, it used to be that you only took probiotics after you were done with the antibiotic, but the current John Hopkins says, no, take a probiotic while you're taking the antibiotic to prevent rebound infection. There are a lot of standard medical doctors who understand that at this point, and then there are a lot that don't, and I still see people who come in with this long history of antibiotic use without any support. And really the first place to start with somebody who's had long-term antibiotic use is to do probiotics, or prebiotics, excuse me. For those people who don't optimize, we get them to eat the slurry, which is to buy a little of every vegetable and fruit you can find in your, organic of course, that you can find in your store. Take it home, chop it up into little pieces, throw it in the blender, blend it up, freeze it in little containers, and every day eat about 1/4 of a cup of that. That's the food. Now, I haven't done that. I'm going to tell you right away, I haven't done that, but I don't have the need to do it. But if I had SIBO, if I was having to take this every day, I'd start doing it, just because it's the whole food way to do it. And foods are always better than supplements. So, and you do have the recipe for that.
How long is long antibiotic use? How long? For the
Any
long-
more than one course. The fact that, I don't know, I had a patient this week who had literally been on, I mean, people are on antibiotics for years, but then, they get off, and then suddenly something rears its ugly head and they're resistant. So they wind up having 3 courses of antibiotics in less than a month, and you kind of go, okay. So, and it's different for everybody too. If you have a leaky gut and you don't have a good solid short chain fatty acid soil in your gut, then you probably are more susceptible to problems with antibiotics. Antibiotics are routinely given for dental work, for anybody who's had a heart problem. It's routinely given for any kind of surgery, and I don't want to be responsible for anybody not taking antibiotics if their doctor has told them to do it, but I'll tell you that I never take antibiotics if the doctor tells me to take them, and I've never had a problem with it. In other words, if you keep your probiotic, if you keep your natural microbiome going, it will kill what's around you. It will take care of you. Again, I'm not saying you do that, I do it. And the last nurse practitioner that I told after a surgery that I had to have that I didn't take the antibiotics, she just put her earmuffs on and said, don't ever tell me that again. I don't want to hear it. Just, you do what you want, but don't ever they don't want to know it. So just go with the flow. Keep your microbiome up and make sure you don't have a leaky gut. Any time that you have a stressful event, for me recently a stressful event is driving into Norfolk or forgetting my mask. But if you have repeated stressful events, that's a good time to check in with your gut and know if it's working, because your gut is usually the first thing that will respond. Your gut is like the little baby inside of you, you know. How many babies have problems with colic? How many babies cry the minute they're hungry or if they're constipated? Babies respond like that to what's happening in their gut, and you can usually see it too. Their gut will get poochy or it will get hard. Usually there's some part of you crying inside if your gut's not right. So tuning in and understanding what's going on is a good idea. In other words, meditation before you go to sleep at night, just tuning into your gut and what you're feeling. When somebody has punched you in the gut, you know, it's probably a good idea to do something that's actually physically helpful for your microbiome.